Hello, this is Falguni and welcome to the first episode of this enlightening series called Joyful Birthing. Today, we will be delving into the world of Caesarean section surgery, also known as C-section. Umarji Mother and Child Care Hospital, Balewadi, which is renowned for its maternity and IVF facilities. Today, we'll be talking to Dr. Chinmay Umarji, who is the Director and Lead Consultant of Fetal Medicine and OBGYN, and also is in charge of Fetal Medicine in Sassoon General Hospital. He will share some of his insights and also clear all your questions. Hello, Dr. Chinmay, and welcome to Pune Times Mirror. So first and foremost, the first question will be, what is Caesarean and where has this word Caesarean come from?
Hi Falguni, and many thanks for this question because there's a lot of confusion around this, and if you look at historical data, there have been data dating back even a few centuries ago which suggest that Caesarean and its practice was existent even back then. Back then they used to do Caesarean just to save the baby in an ailing, dying mother, usually after her demise. The word comes of course after Julius Caesar, and the folk tales tell us that he was born by opening up a mother's tummy, and that is why the word Caesarean. If you look at the history of modern Caesarean, even that dates back to a century. Caesarean is probably the most common surgery performed on human beings in the modern world.
Okay, so that it has Julius Caesar attached to this.
Right.
Okay, so my first question related to Caesarean would be, shall a woman with less water around the baby undergo Caesarean section?
A very good question, Falguni. So, water around the baby is an indirect marker of baby's health. So, in some cases, a lesser water around the baby may mean that maybe health is being compromised, but that's not the only marker, and that's rarely is a decision maker in the timing of birthing and mode of birthing. There are many other criteria like baby's weight, comorbidities in the mother, other risk factors in the baby, blood flow to the baby, which will decide when a baby should be born and how the baby should be born. In modern medicine, we do not offer Caesarean just because water around the baby is lesser.
Okay, so if the mother is having twins, would you recommend a C-section surgery?
Twin pregnancies are inherently higher risk pregnancies compared to a single baby. It's one womb who is now looking after two individuals, and that's why the resources are shared. Luckily, when twins are being born, usually both of them are slightly smaller than a single large baby, and if they are not sharing the sac, and if the first baby is head down, a twin pregnancy can also be offered a natural birth with additional precautions.
Okay. So if the baby has like already opened his or her bowel and has a cord around its neck, so how difficult is it to perform a C-section surgery?
Again, like any other high-risk pregnancy, this is inherently a condition where we need to monitor the baby more closely. We want to understand why the baby has opened the bowel. A common cause why baby opens a bowel is usually heartbeat variation, and this can be monitored by monitoring baby's heartbeat. If baby's heartbeat remains stable and normal, these babies should be offered natural birth and not a Caesarean, because their lungs are already full of meconium, the fresh potty a baby makes, which does not, by the way, have bacteria, so it does not cause infection on its own. And the process of birthing, which squeezes baby's lungs, takes all the water out of the lungs, and that actually helps babies take a better breath. So, meconium aspiration syndrome, as we call it, cannot be significantly reduced by offering cesarean to these babies, and natural birth is actually beneficial for the mother and many of these babies.
So would you say it's risky?
You should monitor these babies more closely, and actually offering a natural birth is a safer way for the mother.
Okay. Next question is, if the first delivery of the mother was a C-section, is it mandatory or necessary that the second delivery will also be a cesarean?
Not really. So Falguni, what we need to understand here is the fear factor. There is a scar on the womb through which the baby has come out, and now that scar, like any scar on our body, becomes slightly thinner and a weaker point on this balloon, which is mother's womb. During labor, there will be a lot of pressure in the womb, and doctors are afraid that this scar may open up. If you look at the statistics, chance of scar opening up is only 1 out of 200 deliveries after one cesarean, and that may be considered acceptable with majority of the mothers, and offering a natural birth can help these mothers recover faster, look after their elder child as well as the younger child in a more efficient manner, early discharges, and there are many other safety aspects and betterment aspects which are associated with a natural birth after cesarean, a VBAC or a vaginal birth after cesarean as we call it.
Okay, just to add on to this, I was a breech child, and my mother had to undergo a C-section surgery. But 4 years later, when my sister was born, again she had to undergo the same surgery. So was this linked?
Was your sister also a breech child?
No, she wasn't.
Right. So, a very important aspect which you are raising here, Falguni, is that how do you increase safety of these mothers when they are delivering? Right. And this applies to any other mother because labor is a dynamic process. You cannot say that somebody is delivering for the first time, so she requires lesser safety compared to somebody who has had a cesarean and now she is delivering. So let us come to a more basic aspect of how to make labors safe. And how you can make them safer is by offering the latest technology like monitoring of the fetal heartbeat, for which there are newer machines like wireless CTG monitors, and now we have gone a step ahead where we can actually take baby's heart's electrical activity and use it to monitor baby's safety. Similarly, there should be an ultrasound machine on the labor room which can help you reduce the number of internal checkups and improve the safety of birthing. And there should be a team of competent doctors, obstetricians, anesthetists, pediatricians who have a culture of supporting the mother in every labor, especially in high-risk labor. If you offer this entire setup to a mother, which is her right by the way, then you can assure safety, and then not only VBACs but every labor can have better safety profile.
Okay, so this ensures the safety of the mother as well as the child.
Right, it improves it.
Okay. For example, if the mother has high BP or diabetes, how risky is it for her to undergo a cesarean section?
Let us take both the conditions separately. So a mother with high blood pressure, it could be pre-existing high blood pressure or a high blood pressure because of pregnancy, also called as pregnancy-induced hypertension, and its more severe forms including preeclampsia and eclampsia. Of this entire spectrum of hypertensive disorders, eclampsia, which is fits in pregnancy because of high blood pressure, is a life-threatening complication. In India, we lose many mothers and children because of this complication alone. There are ways to prevent it, but the most successful way, once pre-eclampsia is set in, is just to deliver the mother at the appropriate time. Mind you, delivery here does not mean a cesarean, and these mothers actually progress very well, and majority of them achieve vaginal birth in lesser time compared to the mothers without high blood pressure in pregnancy. A cesarean should be offered only for obstetric indications, meaning if a high blood pressure is not getting controlled by routine maneuvers and medication, and it seems like labor is going to go a long way before the baby comes out, then to save the mother and the baby, sometimes cesarean may be offered. Now let us come to the second part of your question, which was diabetes in pregnancy. In modern Pune, we have to remember that diabetes is increasing rapidly. Indians are at higher risk, and increase in age of pregnancy, increase in the body weight of the mothers has increased the chances of diabetes in pregnancy. 1 out of 5 to 1 out of 4 mothers get diabetes in pregnancy, and it goes largely unnoticed because of suboptimal testing. So all the pregnant mothers should always remember this, have low carb, high protein, high fiber diet, should have active lifestyle, and if they screen positive for diabetes, they should be thoroughly managed by endocrinologists, the doctors who specialize in management of diabetes. As many as 80 to 90% of these mothers do not require medicines. This diabetes can be managed by diet alone with the right exercises. But this needs vigilant monitoring. Uncontrolled diabetes has impact on the mother because it increases baby's size, water around the baby, leading to premature births, urine infections. If they need a cesarean, the stitches may have more chances of infection compared to the mothers with normal sugar. The chance of traumatic deliveries, vacuum births, cesarean section increases. This also affects the baby's health. Babies put on more fat. If they born preterm, they get more days of hospital stay. They may require ICU for the babies, and they also have long-term impacts. They may have lesser sugars immediately post-delivery because they were used to high sugar while they were in the mother's womb. They may have more chances of jaundice, fits, lower salts in their blood, inability to maintain temperature, requiring NICU admission. They may get a deadly complication called as hypoglycemia, low sugar, which can sometimes affect their IQ as well. In their later adult life, these are the kids who are going to be more obese, may have diabetes, high blood pressure and heart disease, what we call as metabolic syndrome. And mothers, if you are pregnant, you have a golden opportunity to eradicate all this, to make your baby healthy, to make your society healthy by getting appropriate tests and vigilant monitoring for sugars in pregnancy. If baby remains normal size, which they will with the appropriate care, then you do not require cesarean. You can achieve a successful vaginal birth, which will ensure lesser infections for you and better recovery for you, apart from many other benefits of natural birth known and even unknown to humans as of today. Your cervix has a lot of strength in it. This tiny organ of cervix, this brown portion, this is already opening now here, but it was tightly closed like a cylinder almost 9 months and actually practically all your life. Now this has to steadily and slowly start opening and then opening, so that more and more pink portion is seen, so that it completely opens up to allow this big individual to come out of you.
So doctor, what are the advantages of natural birthing?
Excellent question, Falguni. Many times I get women and they are changing their care. When I ask them, why are you changing your care? They say, your hospital is famous for natural birth and we want natural birth. When I ask them exactly the same question, why do you want it? What are the advantages? Many times they don't have an answer. So thanks, Falguni, for asking this question. And what one needs to know is that we have been delivering for millions of years by this method. And as of today, only a few of its advantages are known to us. And every passing decade, we are learning more and more about the advantages of natural birthing. To put it simply, I tell my patient 5 B's and 1 C. Natural birth increases the compliance with breastfeeding. It has better recovery for the mother, lesser chances of blood clots in the legs for the mother, lesser chance of breathlessness, also called as transient tachypnea of newborn, a condition which requires NICU admission, sometimes ventilation for the babies, and lesser chance of bleeding for the mother. By definition, we say bleeding is more in a natural birth if it is more than 500 ml. It is considered high after a cesarean if it is more than 1 liter. So that much of blood loss can be prevented by natural birth according to the existing data. It also reduces the chance of chronic pelvic pain, pain at the scar site, which happens to around 4% women after 1 cesarean, around 1 out of 5 women after 2 cesareans, and rapidly increases with every additional surgery. Say if somebody had 2 cesareans and say a gallbladder surgery, the complications are higher. So avoiding the very first surgery is a way to healthy life, and that is the reason why we usually suggest natural birth is preferable compared to a cesarean. A very important point which we have started understanding in a recent decade is bacterial flora. Our body is colonized by healthy bacteria. They are the real Suraksha Kavach which protects us from outer infection. May they be viral or other bacteria which are harmful to our body. This bacterial flora is very dense in the vagina. If you look at our skin, every square centimeter of skin has around 3,000 to 5,000 healthy bacteria. When it comes to vagina, around 1 lakh healthy bacteria per square centimeter. In the process of natural birthing, as the baby breaks their water, these healthy bacteria, they start going on to the baby. They start colonizing the baby and they provide the first immunity to the baby. And this golden opportunity helps them in the longer run to stay healthy. This we started realizing very recently. So as I was saying in the beginning, there could be hidden treasures in the mother nature and the process of birthing which we may not have uncovered so far. And thus, if you look at all our guidelines, they promote natural birthing, reserving cesarean as an important tool for very few select deliveries.
Thank you so much, Dr. Umarji. I hope this helps and enlightens every mother-to-be. And after watching this video, I think they'll have a clear view on C-section and cesarean deliveries. Thank you so much.
Many thanks, Falguni and Pune Mirror, for giving me this opportunity. And I hope our talk today helps our mother not only get knowledge but wisdom about birthing. So wish you all a very happy pregnancy and happy birthing. Thank you.